Dr. Larry brings you another segment of Did You Know?
We've all heard somebody say, I got a bad hip. Or maybe we say it about ourselves. In addition, commonly in healthcare, there's a lot of chit-chat about bones and joints. We ache as we age, then our joints begin to rage. And eventually, at some point, many of us will have to address some type of bone or joint issue. And you might be hurting so bad, you need a Kleenex or tissue. Or maybe you're just the weekend warrior or athletic type. And after an accident or injury, you know that noise in your joint just ain't right. So where do you go? For a hip, a knee, or a shoulder that's screaming no? It's a field of choices, but when it comes to choosing an organization of surgeons for something as important as, let's say, a knee or hip replacement, you'll want to choose a facility that has its processes and people operating like a well-oiled machine. Now, we don't get to hear from owners of medical clinics on the history of their clinic or why they do the things they do because, well, most are hospital-based, but that just changed today. Because it's the style of this next organization that separates them from the rest. They are doctors who not only own the clinic, but they actually focus on the patient. So pay close attention to our next guest. He's a practicing physician, board certified in a specialized field of bone and joint care. Also, he represents one of the best patient care clinics around for orthopedics. Folks, this crew has their act together. So for the sake of simplicity, we'll call this segment Ask OSMS. Dr. Schechinger, welcome to the show.
Thanks for having me on, Dr. Larry.
Yeah, and we've got to get a few of the formalities out of the way first. So just give us your full name, first and last is fine. You don't have to worry about the middle name.
Dr. Steve Schechinger.
Okay. And your license type?
So I'm a medical doctor, an MD.
Okay.
And I attended Creighton University.
All right. And as far as your board certification goes, what's that?
So I'm board certified in orthopedic surgery.
Okay. And, the reason why, and we're going to jump into this here in a minute, orthopedic surgery, everybody's kind of familiar, generally speaking, in a general sense of what an orthopedic surgeon does. And every facility that has orthopedic surgery has a certain way of doing things, but ultimately, after 22 years in practice, and I've seen the field of facilities and physicians out there, I wanted to bring you guys on the show. And when I talked to Darren, who also works at your facility there, we split this up into two ways. And I thought, and it was a really good idea to kind of give an overview of OSMS. And I know locally here for the listening audience, especially in Iron County, but even the surrounding area and even further, people generally have an idea of OSMS. They know where it's at. They know your orthopedic surgeons. But what I wanted to dive into for this segment to start off with was an overall too, I want you to kind of give us the role maybe of what an orthopedic surgeon plays as far as in the average person's span of life, what the purpose is, just a general overview. And then we're going to kind of get into the meat of the show with the history of OSMS, what it stands for, by the way, because people will ask me, Dr. Lee, what does OSMS stand for? And then also we're going to get into what it's like there for the staff, for the average patient, and then we're going to get into some of the real good stuff, the advantages of OSMS, kind of an overall sort of blow by blow on what you guys do and excel well. But overall, just for everybody, what is the overall role from your perspective that an orthopedic surgeon plays for the average person's span of life?
Breaks over. Time to get cracking once again with Dr. Larry.
Welcome back. Or if you are just tuning in, it's right in the nick of time. I'm interviewing Dr. Steven Schechinger, orthopedic surgeon and one of the owners of OSMS. This is part 2 of my interview for you. Roll tape.
Well, really, the job of an orthopedic surgeon is to provide musculoskeletal care. And that really stems from infancy to adulthood. So every stage of life certainly has orthopedic issues and musculoskeletal issues that patients will have at infancy. Seeing patients for hip issue, alignment issues, growth issues, fractures or other injuries, and then as children, athletic injuries, fractures or sprains, and then into adulthood, dealing with weekend warrior athletic injuries, fractures, osteoarthritis of the hip or the knee or the shoulder. So kind of managing those patients' musculoskeletal issues, sometimes acute, sometimes chronic, throughout their lives.
Excellent. Yeah, I remember I was played sports, of course, when I was younger, and then when I went into chiropractic school, we were playing flag football. We had some excellent athletes. Some of the guys one guy played fullback for Boston College, and then we had the rugby team. So we got a bunch of people out there. They're in their mid-20s. They're past undergrad. And I snapped my finger, and I was like, I know I broke it. So direct call to an orthopedic surgeon that was in the area in Georgia, and it was great because he came in. He said, look, here's the deal. I can pin it, or you can let it heal as is. It'll be a little crooked, but it'll be fine for you. And that was about 25-ish years ago, and I'm still bending it today. It was fine, so I decided not to pin it. So I brought that question out too because that was in your 20s, but like you said, younger age as well too, fractures, musculoskeletal care, all the way up through towards the later parts of life. Well, thank you for answering that. Now, the whole purpose is I want to dive into OSMS. And first of all, just what does it stand for? So we're all clear on that. What does OSMS stand for?
It stands for Orthopedic and Sports Medicine Specialist.
Okay. And right on your website, big thing that's promoted and definitely comes through both in actions and in words and what you guys do. You are doctor-owned, patient-focused. What does that mean?
Essentially, what it means is that we are a private practice group, which means that the individuals who make the decision for this office and how we treat our patients and the care they receive are the physicians. Versus a hospital system where the physicians are often employed, the decisions are made by the administrators who sometimes don't have clinical knowledge. The people who are going to be making the decisions for the care of our patients understand what it means to provide quality, low-cost care and how important it is to the patients in Northeast Wisconsin and Michigan.
Excellent. And from personal experience, taking that, if you want to call it a mission statement, and then how that translates to the average patient or consumer, it makes a huge difference. And as far as that goes, having the physicians being directly involved in the administrative process and not the administrator being involved in the physician's process, that little quick reversal of that role and setting that premise straight gets things streamlined, handles things how doctors want things handled, and overall, it's why you guys have such high patient satisfaction. Next thing I want to ask you too is, as a doctor working there, what is it like, let's say on a day-to-day, month-to-month, what's it like just working there?
Well, I think we've got a really great environment here. I've worked in different settings throughout my career, be it hospitals or other clinics in other areas. And the environment in our office is really special, I think. Everyone's committed to a culture that we've tried to really grow over the last decade, to where we're all focused on one goal, and that's providing good care for the patients. And it's really a rewarding experience when you know that the other doctors you work with, our employees, the people who are at the front desk, from the moment a patient walks in the door, we have the same goal, and everyone works really hard to achieve that goal. It's also nice to know, personally, if I have a medical issue or a concern or an orthopedic issue, I don't have any concern about seeing any one of my partners to have them take care of that or to take care of my family. Because if they weren't good, they wouldn't work in our office, because we really want that high quality care, and we make sure that we are constantly monitoring that.
Yeah, so you brought up a point there that you actually have hospital experience, and you have just based on your own personal history there, and professional history, you had an ability to kind of compare and contrast the different styles of environments. And, jump us into, just real quickly for a minute or two, like a meeting. So you're setting up, patients call, generally speaking, when somebody says they want to seek orthopedic care and they need somebody, they want to make a phone call, they want to come in, and they want to be seen, handled, and taken care of. It doesn't necessarily mean surgery, but as far as how you guys set up policies go, like you guys are in a meeting room and you're talking about stuff, what's like some of the decisions that you make to make things better for the patient overall? You're in a meeting, you're talking about, okay, we got to handle this issue. And maybe if you want to draw on like one issue you had to iron out, or maybe not even an issue, just an initiative, let's say, what's that like as far as the meetings go? And the reason why I'm asking this is because it's different. I've been in other types of meetings and I've sat there sometimes scratching my head going, this is not making a connection, or I've been nodding my head up and down going, this is excellent. This is exactly what needs to be done. But so what's it like overall, as far as a meeting, if we're translating it from doctor-owned patient focus, what does it look like? Like, how do you set up something that this is what the patient needs?
So we've set up our organization so that we have an executive committee, which is made up of physicians and our CEO. So when there is a patient issue, the thing that I think is unique about our office, if a patient has a concern or if we feel that there's an area that we can improve on in terms of patients are waiting too long, or when they make a phone call, we want them to get a call back that day or within 24 hours. They need their results right away. People don't like waiting over the weekend. So the benefit of that is we as clinicians can make those changes right away. It doesn't have to go through the bureaucratic process of the hospital and multiple committees. When we voice a concern, we talk to our employees, we put it in, we implement those things so they happen really quickly. And I think that really plays out to the overall patient experience. When you come in, you know that your concerns are going to be heard, and if there's something that's not right, and you relay that to us, we're going to fix it and make that experience better for the next patient or for you the next time that you come into the office.
It's excellent. So I had a patient just come in. I had sent you guys. It was just, she had a right leg limp, elderly, and so I had some concerns, and I just wanted some things checked out. And so she and her husband both went down there, and I think they brought their daughter as well too. And so they came back. And by the way, too, patients, whenever I refer, they always give me feedback, and because I ask, and they know I'll ask, so how'd it go? And one of the things that the husband said to me was, he said, Dr. Larry, we were in, we got seen, and we had everything done, including the x-rays. We were seen by the orthopedic doc. He reviewed everything. He gave us a couple things to do, said to follow up in 5 weeks, but this is what he thought it was. And he said that was one of the most efficient doctor's visits I ever had, and that was at OSMS. And that was just within the last week or so. So exactly this. And folks, as you're listening to Dr. Schechinger explain this stuff, this is the difference. I was at a meeting at a hospital a while back, and I was talking to one of the physicians there, and we were in a side conversation, and then he was talking about something he wanted to get done for patient care, and he looked it over one of the staff. He says, but boy, things take a long time to get done here. And they all kind of laughed. And so this is the compare and contrast. That's what we're doing here. We're not swiping negatives and positives. We're just comparing, contrasting, so you can see and feel the difference, because ultimately, as you know, is the more efficient, streamlined, and patient effective, high quality care that you get leads to outcomes as well too. So second question I have under the same type of category for the staff, what's it like for them there? Because I always tell my girls that work here, I go, hey, you're the first person they hear. It's not for me. I'm the second person. So what's it like for the staff that work there?
We really pride ourselves in our workplace culture. So we have 27 fundamentals that we go through with all of our employees in terms of the way we treat each other, how we solve problems. So we have kind of a like-minded approach so that if someone has an issue in the office, they feel comfortable addressing it with their coworkers directly, so that we can get efficient processes and improvements. Overall, I think our employees are really happy. I think that they enjoy what they do, and that ultimately translates to good patient care, because people who love what they do and are excited about it and really want to succeed. That just translates. The patients can see that when they come in the door. It translates into success for everyone, the physicians, the patient, and the employees.
Excellent. And I'm setting the backdrop for really the very key questions that I want to ask when it comes to getting absolute defining what you guys do in splitting hairs in this regard, which is some of the key advantages of patients seeking care at OSMS. And I laid it out in three distinct advantages as far as the focus for the show today. There's going to be something we're going to get into called the procedure room, but why don't you go through the maybe one or two advantages of patients seeking care at OSMS? What would be one key advantage?
I think aside from what we kind of discussed it already, being a physician-owned or a private clinic, we're able to really streamline those processes and make things focused on the patient and their experience. I think cost is a big benefit of our office. I know we'll talk about the procedure room, but we also have a surgery center, and it's just comparing costs of that surgery center versus a hospital setting. If you have if you have a knee scope or a rotator cuff repair at the surgery center or a knee replacement, those costs are about 50% less compared to a hospital setting. And that's a big deal. We look at the overall scheme of healthcare dollars and out of control spending on overall healthcare in the United States. Stuff like that can make big changes going forward. Another thing I think is quality. Overall, if you look at infection rates at our surgery center, they're significantly lower than the national average and dramatically lower than any hospital. Infection rates are about 0.15%, which infection rates at surgery centers nationally are at 0.8, and at hospitals are 2.5. So anytime you can reduce those risks and provide high quality care at a lower cost, that's a big bonus for patients and just healthcare in general.
Well, I tell you what, I mean, just listening this alone to this talking shop in this regard, I'm gonna go back to what you said about cost, and then we'll talk about just briefly again the infection rate, because I'll tell you, I'm sure patients tell you the same things in certain regards that they tell me. But I think each individual practitioner gets a different sort of feedback, conversation based on how the relationship set up, the inherent trust network. So I hear a lot of talk about healthcare costs, number one, and infection. Now, I can speak from experience as far as being a referral source to you guys. I sent you guys 2 rotator cuffs within the last 6 months, I'll say. Both of them females. One had a major full thickness retraction. The other one was a little less, but still they needed some pretty intense rotator cuff surgical repair. Both of them own businesses. Their families did. So these people they were paying out of pocket, and they had come back to me. Not only did they have great care, of course, no infection, but they let me know. They said, "Dr. Larry, I gotta tell you this. We had to pay out of pocket for the rotator cuff repairs, and it was substantially less than it would have been at a traditional healthcare facility, and it was to the tune of 50 to 60% less. So this is a perfect example of where less costs, when done correctly and efficiently by thinking organizations run with there's a direct link between the clinician and the administration, because the clinician's in charge of the administration, not the other way around. It translates to a less cost towards the patient without suffering quality care, which is back to the infection rate. I'm glad you gave that data on the infection rate. Now, as far as the types of specialties that are available, I think, it's plainly obvious, hip and knee, you guys have the orthopedic care, but what is, as far as orthopedic care, the OSMS style and way of doing it? You'd mentioned about the doctors that you guys have that are hired there. Is it one of those things where the name is kind of known and you have applications of doctors, or do you guys recruit? How does that whole process work to, for example, somebody that does hip replacements, what makes them part of your team versus maybe some others that are not? Hope you're enjoying the interview. There's a couple more points and highlights still to review. So NFL draft, but at OSMS, how they pick the top surgeons to work there. Coming up, stay tuned. This is the Dr. Larry Radio Show. We'll be right back.
We'll be right back with Dr. Larry. We're back with Dr. Larry.
Welcome back. So listen to how OSMS, the doctor-owned patient-focused, handpicks their doctors and their recruitment process. Roll it.
Well, part of it starts with our initial recruiting process. So almost all of our recruiting involves direct referrals from chairmen of program that we respect or someone we know personally through our training. We talk to that individual. We talk to their peers to see the quality of surgeries they do. Obviously, we meet with them in person. They meet with all of our physicians. And then after that, they undergo a period of employment where we're able to evaluate and make sure that everything checks out and that they meet the standard of quality that we want to be a long-term part of our organization. And that goes with the orthopedic surgeons that are a part of our office, as well as rheumatologists and our pain specialists as well.
And you, in addition to orthopedic care, and we're talking for any movable joint, elbow, arm, hand, shoulder, knees, wrists, is there anything excluded that you guys don't do as far as orthopedic care goes, or you essentially are a full suite, you do it all?
At this time, so we have hand specialists, foot and ankle specialists, sports medicine specialists, as well as total joint specialists. We do not have an orthopedic spine surgeon in our group right now. And those are things that we're obviously looking at and exploring. So if someone is seen in our office and has back issues or ongoing spine issues, we'll initiate that care. So we'll obtain imaging studies. We'll make referrals to appropriate chiropractor, physical therapy, or pain specialists, potentially sometimes for injections, and then set up a referral to a spine surgeon if that's necessary in those rare circumstances.
So in a case, so everything except for orthopedic spine surgery, but in a sense, somebody comes to you as they would, you're still handling the next sequence of care. So you're going to do some workup, do an eval, obviously, and then we're going to jump into the pain management component here too. But if they seem to be heading towards some type of orthopedic spine surgery, you'll set them up for the somebody that you use or a facility you use, and then take it from there. So basically, it's still the ball is handed off to the next step if needed. Okay, as far as the pain management goes, I just started utilizing OSMS more for pain management. I did not know you had a pain management physician, and somehow, some way, over the last 6 months, I think I discovered it. And so as far as pain management goes, what is that department? I mean, we hear that, and it's kind of a general overall term. As clinicians, we know what it is, but for the general public, what does that mean for pain management the way OSMS does it?
So typically, pain management really involves conservative management of pain. And sometimes that pain can be related to spinal issues. That's a common issue that they see in terms of spinal stenosis or radiculopathy, but also chronic pain from fibromyalgia or other pain sources. And that physician is looking at conservative ways to address that pain. And sometimes that's referrals to physical therapy or chiropractic care. Sometimes that's medication. Sometimes it's other modalities such as acupuncture. And then sometimes it's selective injections that can be done to address that pain.
So are we talking like typical epidural steroids or transforaminal injections, those types of injections?
Correct. Yeah, epidurals, transforaminal steroid injections, radiofrequency ablation, kind of the whole gamut of those injections, as well as joint injections, ultrasound-guided injections into different joints or the bicep tendon sheath, or selective injections that we'll sometimes do to help either rule in a diagnosis or provide some therapeutic benefit.
How long ago did you guys implement this as part of the overall OSMS?
Our pain specialist joined us about a year and a half ago, and we're looking to grow that as well. So he's gotten full very quickly, and so we're hoping to expand that so patients have a little bit more access.
Excellent. And just as far as timeliness goes, I just had a follow-up visit from a patient I sent your pain management crew or individual, and it was I said, overall, how was the response? She goes, what? Her husband came with her. Everybody likes to bring their spouses sometimes. And she said, my husband thought that was the most thorough evaluation he has seen me get, because she had been to some other pain management groups, and he was thoroughly impressed. And that was literally this morning, and I knew I was going to talk to you this afternoon. So I just wanted to compliment you on that too. For a brand new program you guys just started 18 months ago, and like you said, he's already full. And I just tried to send another referral to you guys, and yeah, it's already bumped out till March, but no big deal. The patient understands, and I've got kind of her in a bit of a Band-Aid situation now until she comes see you guys. Now, you do have, in this one, I have not had I've not sent or heard anybody utilizing you for acute care clinic, and I want to get into that, but you have a rheumatologist as well too, or you have rheumatology. What's that department like, and what do you guys offer through OSMS as far as rheumatology goes?
So we have the largest rheumatology group in northeast Wisconsin. So we have 5 rheumatologists in the Fox Valley, in Marinette and Green Bay. We also have a pediatric rheumatologist, and they deal kind of the gamut of inflammatory arthritis. So they'll see patients who have rheumatoid arthritis, lupus, Lyme disease. They also help to manage osteoporosis, juvenile rheumatoid arthritis. They have an infusion center, so sometimes these patients who have inflammatory arthritis require infusions of medications to treat that, and they'll get that at regular intervals, and so they can help facilitate and do those infusions for the patients as well. It's really it ties in well with orthopedics, because a lot of those patients who have inflammatory arthritis ultimately need to have joint surgery because of joint destruction and issues over time, which leads to joint replacement or some type of hand surgery or procedures as well.
And we're talking full-fledged rheumatologist, and that's what we're talking about here, correct?
Correct.
Okay. And so as far as off the top of your head, the lead time for getting in to see a rheumatologist, do you know what that is? Is it 2 to 4 weeks, 4 to 6 weeks, or longer than that?
At this time, it's probably about 4 to 6 weeks, which we'd like to reduce. Normally, waits to get into a rheumatologist are around 3 to 6 months, so we're much better than the average, but we'd like to improve on that and get that wait down significantly less.
Well, the fact is, so I on purpose asked you that because I knew what the wait time was. Traditionally, rheumatologist was about 4 to 6 months, and so I had no idea what your lead out time was on that. So I was kind of curious to see how you guys, if you're able to reduce that down, and that's roughly 80% shortened up wait time. And while I'm thinking about it, referral required for pain management, rheumatology, orthopedic care. Can patients, generally speaking, if they feel like they've got one of those issues, can they just call you guys directly, or do they need a referral, or is it a combination thereof?
Yeah, so we don't require referrals. Patients can just call and make an appointment. We have an acute injury clinic as well, so you can also just walk in if you have an acute orthopedic issue, and you'll be seen. Some insurance companies do require, if you're going to see a specialist, they require that you have a referral of some kind, but most don't. Most Medicare does not. You can just give a call and make an appointment.
I do want to focus. We've got a few minutes left before we have to close this segment here, but would you mind the acute care clinic? Describe as far as that clinic, how it's set up, and how people can utilize that acute care clinic. And the reason why I'm asking this, like I just had a slip and fall humerus fracture, right side come in. Had gone in to an establishment. They had saw that it was that it needed some type of orthopedic intervention, and hadn't been seen by an orthopedic for, it was be 9 days out. And then after that, it was going to be, well, I can't do the surgery, so it would have been another X number of days out. But let's say, for example, so first of all, I want you two things. Number one, what is the acute care clinic? How is that set up, and how can patients utilize that? What's it for, and what's the sweet spot for that?
So it's an acute injury clinic. Basically, we set it up because what we found is patients would have an injury, just like you described. They fall, they break their wrist, they have an ankle injury. They go into the emergency room and usually get a $1,000 bill. They put them in a splint or a cast and then tell them to see an orthopedic surgeon. And we just decided, it doesn't make sense as a whole pathway of care. And we really wanted to cut out the middleman. And so instead of patients going to get the temporary care, we just have them walk in. So if a patient has an issue, if they break their wrist, they come into our office, they'll see an orthopedic surgeon that day, and they'll get the definitive treatment, whether that's putting them in a cast or conservative management or just an x-ray to make sure everything's okay, or sometimes surgery. Now, surgery doesn't always happen that same day, but at least you've seen your surgeon and it gets scheduled, and you have a plan in place. Without having to have those unnecessary long waits in the emergency room. So it really helps in terms of cutting down cost and the whole overall efficiency of care.
Excellent answer. And I brought up that recent humerus fracture purely for that reason alone, because that is the standard and that's the norm. And I see it on the ground level here, patients coming in, they maybe I'll see them midweek and they had a situation like that. Folks, if you just heard what Dr. Schechinger just said, they want you to come down there with those types of injuries. They're set up to cut out the middleman and the red tape. So, for example, an hour and a half or less drive, and you get to see if you've got a slip, fall, accident, injury, acute care. That's what it is, acute care clinic. It's the equivalent of a extremely efficient emergency department for acute care, but they're calling it acute care clinic. So just because you may have an emergency situation, even if a fracture anywhere, or maybe even if it's just a sprain and you want to know what it is, OSMS is set up for you to come for that. They want that type of service. Otherwise they wouldn't have it, and they can handle it from there. And it cuts down on days. The patient I just mentioned, they would have been at least 14 to 21 days out, most likely, until they finally actually got the procedure done. And actually, by the way, I sent them to you, and they're calling you last week. So, Dr. Schechinger, I really appreciate your time. Thank you for going overall OSMS, the style and the way you did it. You did a great job of answering really these questions that are functionally basic questions, but overall we're interested from a public standpoint. I'm interested from a clinician standpoint as a referral source. And if listeners want to know more, what's the number they've got to call to get a hold of your crew over there?
So our office number is 920-430-8113. And if you call that main line, that would get you into any of our offices.
Excellent. And then you guys have a website as well, too. What's that?
Website is OSMSGB.com.
Excellent. Okay, everybody, this is Dr. Schechinger, Stephen Schechinger from OSMS. And as you heard, he works out of the Green Bay. And what was the other office you work out of?
The Marinette office.
Marinette office as well. Thank you for coming on the show, and I look forward to doing some potential follow-ups down the road.
Well, thanks for having me. Have a nice day.
So one more time, on the telly, their phone number is 920-430-8113. Orthopedic specialists are ready for you. They've done a great job. I've used them for years, and as he stated, I can't even recall an infection coming out of there as far as some of the total joint replacements I sent them as well, too. They do injections for rotator cuffs, etc. Okay, upcoming announcements, and our tip and trick of the week is just around the corner. when we get back from the break. This is the Dr. Larry Radio Show. We'll be right back.
Dr. Larry will be back in a moment. Breaks over. Time to get cracking once again with Dr. Larry.
Okay, welcome back. A couple of things before we wrap up the show and get to the weekly tip and trick. Here is the list of the upcoming shows. You just heard from Dr. Stephen Schechinger at OSMS. That was part 1 of our 2-part series. On the second part, it will be with Dr. Walker Flannery. We will dive into more of the clinical side of orthopedic surgery at OSMS, when to see an orthopedic surgeon, total joint replacements like knees, and the anterior hip replacement. We're going to get into that. You're going to find out why you don't need to drive all the way to Minnesota to get that done. It's going to be a hit. And audiologist Lori LaFleur, we're going to get into this tricky little language in your healthcare plan that looks like you're going to get thousands of dollars to cover your hearing aid, but there's a catch. And Lori's going to explain that to you on my show. Finally, my website, drlarryradio.com. It's with a DR. There is now a televisit option. This is a fee-for-service, so there's no insurance billed. Life's good. Now, why might you need a televisit with me? Well, a case example. I just did this for someone who had pain in their neck for 3 weeks, and it was getting worse. He was vacationing. He was out of town and suffering, but just didn't want to see anybody in the area. We did a 1-hour consult over the phone. I figured out what was going on, what to do, and here's what you get with a televisit. A full recording of the visit. I send you the whole visit on an MP3 via email afterwards. Also, I give you a 1-page outline of the visit, which is my assessment, the diagnosis, and treatment plan. That way you can review it quickly on one sheet and or go back and listen to the entire visit. Again, that's a televisit. That's on my website now. There are 3 separate rates for those. No insurance, no middleman as far as that goes. And sometimes that cuts through, again, even just coming to my office. Obviously, if you need treatment from me, but it really gives some flexibility for patients, and that individual utilized it, and it helped him out tremendously when his pain was getting worse, and I didn't even have to do an adjustment. Also, as you heard at the start of my show, all of my shows, including the one you just heard today, are going to be uploaded and ready for you, and I'm happy to announce there's a 7-day free trial. You don't want to miss one show. Become a subscriber today, and it helps support the show as well, too. Some of the content I bring, all this done on my own time, and outside of the office as well, too. I love doing it, but click on the website there, and you'll see a subscribe button, and there's a 7-day free trial. You can check out, I think I've got 35 or 40 shows uploaded, as well as some healthcare posts. Okay, time for the tip and trick, Reed. So you are in the broadcast booth. I'm going to head out center stage for the demo. Actually, I'm going to go over to the wall, and we're going to do a simple self-stretch for tight calves. Tight calves. Here we go.
You heard him, folks. Dr. Larry is currently standing in front of the wall, and he's got the top of his foot pushed against the wall, almost like he's pushing the gas on a car. And that's it. What's your take on that, Doc?
Good job, Rito. Yeah. Tight calves are like tight hammies. When you get a cramp in them, they just hurt. Reed's had some cramps in his calves before and legs. He's nodding his head up and down. Awful. And like a conversation I was having today at my house with a gentleman, he was asking me what I see, what's coming into the office. One of the things I brought up was dehydration. We tend to drink a little bit more water and keep the electrolytes up when it's the summertime. In the wintertime, we dehydrate a little bit. Even though the air is drier, our sinuses get dry, but so do our muscles as well, too. So just gave you a simple self-stretch for the calf. Up against the wall, lean forward a little bit, loosen up those calves. Life is good. Now, remember, too, I'll give you a little quote from clevelandclinic.org. The calf muscle is on the back of your lower leg behind your shin bone, and it actually includes 3 muscles. And what's the purpose of your calf? Well, it supports you when you stand and enables you to move your foot and your lower leg. It propels, or it pushes you forward when you walk or you run. It allows you to be like Superman, to run fast, to jump high, to rotate your angle, to flex your foot, and to lock your knee. We love our calves. We like them a lot. They do lots of good things for us. So some conditions that can affect your calf muscle, of course, is a muscle strain. And the most common type of calf injury is the strain. It happens when the muscle fibers stretch too far or tear, usually results from strenuous activity or overuse. By the way, basketball leagues are going on right now. Heads up. A couple of blown Achilles within the last couple of years as well, too. Recovering from that ain't no fun, as I'm sure the guys at OSMS will tell you as well, too. So keep your calves loose. The calf muscle is a continuation, and by and through turns into the Achilles, which hooks into the bottom of your foot at the heel there. So a nice, loose, happy calf muscle also translates to a happy Achilles tendon as well, too. Again, running and sports, but again, snowshoers. It's that time of year as well, too. Watch out for that. But even just your average walking or waddling out to the car, you got to have good calves for balance, like we talked about last night with physical therapy. Plantar fasciitis, as far as physical therapy goes as well, too. Jim just made a cameo appearance right here in the studio. If this was a game of charades, I think I would be doing good, but he did pass me a note as well, too. Even with you, when you're doing a calf stretch, you can help your plantar fascia, and that will keep that happy as well, too, because fasciitis ain't no fun. Like I mentioned as well, too, leg cramps, look out for those, especially during the winter. Folks, remember, you can listen to me live right here every week to learn how to achieve a better back and better health, or if you're having a pain or problem, I'm here to help. The number at my office is 906-875-3215. Have a good day, boy on the board. I'll see you next week, everybody.